Growing up, I knew my parents were there for me. We celebrated family events. They were there for me when I was sick or needed help. As me and my sister grew up, we knew we could count on our parents. We were so proud to be their children. Today, we are there for our parents, to share in the celebration of their grandchildren or to be there when they are ill or need assistance. They can count on us. And now our parents look to us to take care of them. Hello, I'm Michael Wilsker, and welcome to Always There. I'm owner and vice president of an in-home non-medical care agency called Always Best Care Senior Services, and this is our 5th show, and glad that you've all been able to view us. And today I'm happy to have as my guest Beth Patras. Beth is the executive director of marketing and admissions at the Long-Term Care and Rehab Center in Milford. Welcome, Beth.
Thank you. Thank you. Thank you for having me.
I'm happy to have you here. So, Beth, before we get started in talking about the center, just give us a background and your experience in the elder care industry.
Absolutely, absolutely. Again, my position is Director of Marketing and Admissions, and I've been with Milford Care and Rehabilitation for 19 years. So in several different capacities, but always working with our new patients, existing patients, and the growth of our business. Prior to that, I was with a privately held company that specialized in neuro rehab. So patients that may have had a stroke or traumatic brain injury, but really a neuro focus, and was with them for about 10 years. Interesting enough, I kind of got my degree in communications and sociology, started off in finance, and one of those weird paths ends up in healthcare. But it's a great career, and it certainly was meant to be.
And are you originally from Massachusetts or from Ohio?
No, Pittsburgh.
No,
Originally from Pittsburgh, which
okay.
I know probably people are booing Steelers. I don't know how they did yesterday, but yeah, originally from Pittsburgh. Did they? Oh,
yeah,
okay. Well, and so did New England. So, and yeah, I went to school in Ohio University, and then relocated to New England, moved out to the Midwest to Illinois and Wisconsin, and then missed the New England coast, so moved back.
And how long has the center been? You said you've been with the company for 19 years.
Yeah.
Has it been in the facility in Milford, or has it been in a number of different other facilities?
Primarily, I've worked with Sun Healthcare for the 19 years, primarily with our Milford Center. The Milford is Milford Care and Rehab, and it's one of our flagship facilities. Serving Milford and the surrounding area, we have patients really coming to us from all over for our short-term rehabilitation as well as our extended care.
And where do they generally come from? They come from hospitals?
Really from primarily hospitals. There's a great article in recently that ran in the New York Times, and it talked about admissions to nursing and rehab facilities, because it really has, the patterns have really changed. The purpose of these facilities have really changed, and it's difficult for all of us to keep up with those changes. But primarily, according to the article, over 70% of all admissions to skilled nursing and rehab facilities come from a hospital-based.
And is that by choice? Can they decide which rehab they want to go to once they're discharged from the hospital? Is it the hospital that decides which rehab?
Great question. Great question. I think a lot of what we do, or what I do as my position, is not just work with our center, but also to work to educate the public. And I think that again, going back to healthcare changing, you think way back when it was our grandparents or great grandparents, what healthcare was then and what healthcare is now is just apples and oranges. You can't even compare them. Similar to that, the referral patterns and services have changed, and it used to be that you had a primary care physician, and you looked at that primary care physician to really direct all of your health care. Nowadays, when you're in the hospital, more than likely that primary care physician may be aware of your hospitalization, but that physician is not following your day-to-day needs, and certainly not making recommendations on what the next step is. For that, most of the hospitals have a case manager or a discharge planner, and that case manager is there to gather all of the needs of the recommendations from the attending physician, recommendations from the specialists, rehabilitation, looking at the insurance company and what parameters they require, and then certainly meeting with the patient and the patient's family on what they're looking for. And hopefully the hospitals are making recommendations to at least, I think the common rule is to at least refer to 3 facilities so that the patients and the families have choices. Also, the facilities may not have the capability, they may not have the availability. So to put all your eggs in one basket is really selling the system short. And we have so many options out there.
And how does the caseworker work with your facility? Who do they talk to? Who are the people that decide this is the place where they should go?
Well, if they look at, once the case manager takes all of the information in and sees what is being recommended, is it the patient going home? Is the patient going home with home care? Is the patient needing outpatient care? Or does this patient need skilled nursing and rehabilitation or long-term care? And then they're reaching out to the facility. They would contact myself, or most hospitals, we have a representative, just given the size of what we do, we have a nurse that is there located at the hospital. So it can be just contacting the nurse, contacting myself, letting us know we have the hospital has a patient that's in need of additional services, and where that patient is looking to go. It may not be, the patient may be in the hospital on the Cape, but the family is located in Franklin.
Right.
There's no sense for that patient to have to stay on the Cape. So it's really working within the healthcare system to identify, again, geographically, location, where the family is, the services, the insurance, and all of that.
So if let's say a senior comes out of a hospital, can they go directly home, or are they required by Medicare to go into a rehab center first before they go home?
Absolutely, they can go directly home. And that, again, is part of the referral process at the hospital, is identifying what is this patient's expectations, what is the patient's needs, and how best to serve it. We have obviously great home care agencies that are out there that can step in to help fill that gap. Or in many cases, it's just their home situation or their needs really require more in-depth and inpatient treatment. So at that point, they're looking to admit. In my position, I many times will follow a patient once they go home. Maybe they decide, I do want to try it at home, I'm comfortable at home, my family will help me, and they get home and they realize maybe it's a little bit more than they thought. Or the services or the help from the family is just not going to cover it. Depending on the situation, they may be able to admit directly from home then.
So you serve as the person who the family would talk to about what's the best place to do with mom or dad upon their discharge.
What generally will happen is the hospital case manager or discharge planner will contact myself or our nurse. We review what happened to this patient. We want to know what is their history, what brought them to the hospital, what happened during their hospitalization, and where are they right now? What are they looking for to achieve, and how do we do that? Based on that, then, we would admit the patient. We set up very clear guidelines and very clear goals with the family and with the patient and the physician and our rehab staff. And we're constantly reevaluating those objectives and goals to see, are we missing them? Are we meeting them? Do we need to adapt to them? Have there been changes in the home situation that we need to take into consideration?
When you have a rehab center, but do all rehab centers have long-term care with it, or are there facilities that just have long-term care and some facilities just have rehab?
Correct.
Or is it sometime together?
Nowadays, you generally see both. At least some percentage. How they define their rehab center. If there's a separate space, I know at Milford Care and Rehab we have a strong dedicated space for our short-term residents that are coming to us for a couple days to a couple weeks. We also have an 80-bed dedicated extended or long-term care. And then we just recently opened a 20-bed palliative or program for patients end of life and for hospice care. So each facility will be a little bit different on how they define their space and approach their patients.
And what's the range of ages? Can it be young people up to seniors, or it's usually just in the senior
Average age is generally a senior, but we had a situation, a very sad situation, quite a few years ago, where we had a group of teenagers in town that were all involved in a very serious auto accident. They were initially treated and then flown to Boston, and they had acute rehab in Boston, and they really wanted and needed the support of their friends and their family. So with special permission, we were able to bring them to Milford to recuperate and rehab together. Very unusual, though. I would say we are starting to see, because of the demands of healthcare, we are starting to see a younger population. So it's not unusual in the rehab unit to see individuals that are in their 40s, 50s, 60s, and 70s. We also certainly, with some conditions, have younger patients that need ongoing or extended care and may need our long-term care unit.
Are there specific rehabs that just handle young people, or?
Well, there's acute rehab. If you're familiar with acute rehab.
No, why don't you explain that?
Okay.
Why don't you explain that to the people that are watching?
I think most people are certainly familiar or have a visual, have experience with a hospital in an acute setting, where they're a diagnostic, maybe they had an illness, they had an injury, taking them to the hospital. And in some cases, they will need rehabilitation. Depending on the amount of the rehabilitation, the nature of their illness or injury, the hospital may recommend an acute rehab. And acute rehab is set up kind of as, lack of a better term, maybe a mini hospital would be the way to look at it. They don't have an emergency room. They're not doing surgeries like you would see. They don't have an ICU, intensive care unit, or labor unit, but they're set up for rehabilitation, intense rehabilitation. Not everybody can manage the type of schedule or needs that level of care. So that's when, if they don't need that, they don't meet those guidelines, they don't need that intensity, or can't tolerate that intensity, then you may be looking at a skilled nursing and rehab. Certainly you're still getting the rehabilitation, you're getting the nursing and the physician care, but maybe not as much intensity. And so you tend to see a younger population that can tolerate that intensity, go to an acute rehab, and an older person that may be a little bit, their rehab may be a little bit slower paced, going into a subacute or skilled nursing. Did that make sense?
Yeah, I think it makes. I just wanted to make sure that everyone understood
Yeah.
what acute meant, as opposed to just coming out with a broken hip,
Right.
and going into the rehab. Now, what is the people that go into the rehab? Do they can't go home for whatever their condition is? Then do they generally then go into the long-term care
They can.
unit, or do they also have the choice of where they're going to go after the rehab has ended?
Well, there's always choice. There's always choice, and from every step along the way, there's choices. So, and I say that because so many people are putting additional stress on themselves and their family, thinking the decision that they make today is concrete, and it's not. It's very flexible, and the healthcare system is there to work with the patient, with the family, and make those adaptations as their situation or needs change. So to your question, if somebody does come into a skilled nursing facility for short-term rehab, and maybe they have additional medical issues that come up, or their home situation changes, or they're simply just not able to return to the community, they can stay with us on a long-term basis. Or we will identify what other options are out in the community. It might be going home, but going home with really supported services coming into place. Whether that be from a facility like yours, or a company like yours, or additional family, assisted living, independent living. There's so many different options out there and so many ways to help families nowadays.
Now, we talked about before that there are rehabilitation centers that don't have long-term care. Is that correct?
I think that most of them do. I think that
most of them
the
do.
acute rehabs don't have a long-term
Right.
care, but a skilled nursing, I think I can't think of one offhand that does not.
So long-term care is what we used to call nursing homes. Is that correct?
Correct.
So people could be admitted there regardless of their condition, if that's the point where they've reached and they don't they don't want to have care at home. They want to go into a long-term care facility.
Correct.
Is that correct?
Correct.
And how is that paid for?
That's a good. Most patients nowadays that are in long-term care are paid through a Medicaid program. Every state has an insurance program that's Medicaid, and each state calls their Medicaid program something different. In Massachusetts, we call it Mass Health. Mass Health is a insurance plan. It is a state-driven insurance plan that you must qualify for. So there's an application process, and basically they look at not just your financial situation, but your clinical needs if you are applying for standard Mass Health to cover the cost or defer the cost of nursing home. So the majority that are there. Nowadays, we are seeing more and more patients that have taken out a long-term care policy. And that would be a great topic for here,
Right,
yeah, because
yeah.
that's
Like
we're
bingo to
seeing
all that.
more and more of that,
Right.
that individuals are purchasing while they're working, while they're healthy, long-term care, because they want to be able to defer those costs and cover those costs, or certainly private pay.
Now, Medicaid is a federal program. Do people who are Medicaid, do they have the choice of what long-term care facility they go, or does the
Medicaid or
federal,
Medicare?
if Medicaid, do they have, once they qualify for Medicaid, does the Mass Health determine what nursing home they go into,
No.
or is that a choice that the person who's being covered by Medicaid have?
They make the choice. And we certainly will have individuals that come into our program, and maybe they might have been with us for quite a few years, but now their family's relocating. So they're going to stay with their family. That's their goal, is to be close with family, have that support, so they can change at any time. We've also had individuals that come into our long-term care program or extended care, and maybe they are with us for several years, but they get to a level where they can return to the community. So again, the flexibility is there. Choice is always there.
So if they're on Medicaid, I've heard the term Medicaid beds. Does every long-term care facility have just a number of beds that are allotted for Medicaid, or are all the beds eligible for Medicaid?
I believe, and again, I would, at least from our center, and I can only speak to that, all of our beds are duly certified, meaning they are certified for Medicare recipients as well as Medicaid recipients and commercial and private pay. So where you are in the facility is not determined by your insurance, at least at Milford Care and Rehab. It's where you are within our facility or the program is determined by what your needs are and what your goals are.
Do you ever come to a situation where you say you're not at the point that you should be in a nursing home? Do you sit down with the family and say, I think it'd be better if mom or dad stays at home? I think being in a nursing home is not really the place for them to be right now?
Well, there's a lot of those conversations, and we meet with the patients typically obviously we're doing our due diligence prior to the patient admitting to get a better understanding of their medical history and current medical needs. Then we're meeting with the patient and typically their family within 2 to 3 days from their admission to just kind of go over, this is what the activities, this is the therapy that they're receiving and why, review of medications, goals, talk about discharge planning. What is, if they were living independently before, is that what they're looking to do now? Or maybe they're looking to relocate with a family member. Maybe they want to look at assisted living now, or they want to stay on a long-term care basis. So we're constantly reevaluating that. If their goal is to remain within a nursing facility, there's certain criteria that need to be met, especially if they're under mass Medicaid, that we want to make sure that those goals that they have will parallel the requirements of their insurance and vice versa. So it's educating them. And if we feel that they may not be aware that there's other options out there.
So let me ask this question. If someone's admitted into a long-term care facility, do they have to stay there, or can they go home, or and then come back again? Is that common, or that's very unusual, very rare?
It's a little unusual, but sometimes someone may need an extended recovery program that exceeds what we would typically define as short-term rehab. Generally, when you're talking short-term rehab, you're talking a couple days to a couple weeks. But again, the goal being returning in the near future to the community, being able to get back up to a level of care that will allow you to return to the community. Depending on the patient or their circumstances and their family situation, they may need an extended. And that's why we certainly have had individuals coming in that may have been with us a couple years, but we're able to finally get them to a level that allows for discharge home, or the services that were not there when they initially admitted to us may be available to them now.
And what's the average stay for people talk about the fact that, okay, mom and dad is going to a long-term care facility, that they probably just have a few months left to live, and that's why we're putting it in here. Is that?
I don't know if there, I don't honestly think that there is an average. As I said, sometimes we have patients coming in where the hospital, they're being treated for a condition where they're requiring IV therapy, and they need to have another week of IV therapy. There's no reason for that individual to have to sit in a hospital to receive that. They can come to us and have the IV therapy, so they may just be with us for a couple days. Individuals that maybe had a joint replacement, they had a new knee or a hip, and they're coming to us. We know really that individual, unless there's any extreme conditions, that may be with us for a week to 2 weeks, depending on the situation. And everybody is very different. We've had individuals with the exact same diagnosis, and with a difference in age, where we had a gentleman that comes to mind that had a knee replaced, and he was in his early 50s, and we had in the same day a woman that was in her late 80s have a knee replaced, and she was discharged before the gentleman. She just was able to do it better and do it quicker, and he required a little bit more time because of other factors. So, bottom line is that we were able to treat both and get them home as in great health, and get them home to be able to continue to succeed. Long-term care, there's really no, again, generally when you're admitting to long-term care, this may be your home for however long you need us.
Now, the patients that are in the rehab part of the facility, and then you have the long-term care patients, do they intermingle? Do they have the same programs?
To some extent. We definitely have, our rehab program has it's a distinctive unit, so they have their own programming, their own nurses, their own therapists. We have a concierge on our rehab unit to make appointments for them, hairdressing, etc. Long-term care, their goals are different. Their schedules are different. They still may be receiving therapy, but not maybe on a daily basis. Their social activities may be different. We may be doing a lot more outings because medically they're stable, and I know they have a group going to La Salette soon, and they just did a shopping trip at the mall last week and out to different restaurants. So it's more about social activities and stimulation, whereas the patient that's coming into us for short-term rehab is really focused on getting better and getting home.
So just getting back to the discharge or to the admittance process, I would think that the person or persons that you would speak to would be the family more so than the elder that's being admitted, or is it?
Really both.
Is it both?
Both, because it's the patient that's going to drive their recovery process. If they are their own decision-making party, they're the one that's going to kind of dictate what they're looking to do and how they want to do it. Certainly the family is very important to that piece, and the family, when you're in the hospital, is really acting as your eyes and ears. That a lot of people, and you had kind of opened on how do you pick a nursing facility, or a rehab facility,
Right.
How is that whole process? And the hospital, again, will identify facilities that meet the criteria that the patient and family are looking for, but it's up to the patient and with many times influence from their family to pick which one that is.
Do you also, again with admittance, do you work with, outside of the hospitals and physicians, do you work with geriatric care managers, elder law attorneys?
Elder law attorneys, geriatric, elder services, senior centers. Many times it's the family themselves that are, worried that mom and dad or an aunt and uncle or whoever the family member is in need of services. So they are kind of being the advocate for the family or for the patient. Many times it's the home health agency, that they have somebody that they're working with at home that really could benefit from a little bit more, needs that inpatient care, and they're helping to be the advocate for the patient and do some of that legwork work. So it comes from all different sources.
So you seem to be very enthusiastic about what you
I
do.
love
You
it.
must.
Yeah.
Do you like